Welcome to Maximizing Black Health, where we discuss tools, strategies, and resources to address the unique challenges to health in the Black community. I'm your host, Kwame Terra. On today's episode, I speak with doctors Mark and Mia Burney, two dentists who spent the first decade of their career working as public health dentists, and most recently embarked on a journey to start their own private practice here in New Orleans. We talk about everything from their early careers to some of their challenges that they're facing as they start their own practice. We have a fun conversation. I hope you enjoy, but most importantly, learn something. We talk about many tips and tools and resources and strategies to optimizing your oral health for both you and your children if you have any. So, hope you enjoy.
Yes, yes. Thanks for having us.
Thank you for having us. Thank you.
It's a
Very
pleasure.
happy to be here.
Awesome. So, to start off, just tell us a little bit about your story. How did you guys get into dentistry? I mean, go way back, right? Undergrad. I'm sure the folks want to hear about the love story, all of that. So take us all the way back and how you got to this point today.
Yes, we are married. I'm not going to go all the way back to when I was conceived, but I'll start basically around when I first became interested in dentistry, if you will. Became a big deal to me when I was young, maybe 13, 14 years old. I think I was in ninth grade when I decided for myself I wanted to become a dentist. I wasn't necessarily under the impression I was going to change lives at that young age. It was more so me picking a career, me trying to figure out what I wanted to do with my life in high school. It was around that time I wanted to start taking myself a little bit more seriously academically and set a goal for myself. And that's what I did. And so matriculated through high school, got into college, went to Morehouse College for undergrad in Atlanta, Georgia. Class of '09. Should have been class of '08, but people that went to Morehouse understand. Sometimes it takes us 5 years, and I was one of them. But nonetheless,
We'll unpack that later.
Yeah, we'll unpack that a lot later. I had a lot of fun in undergrad, but nonetheless, man, after I got out of Morehouse, I was blessed with the opportunity to participate in the Meharry Post-Bac program, class 2010. Then I was in dental school in 2011. And after that, well, the rest was history, man. I just kept pushing forward from licensure exam to licensure exam to just actually getting a DDS behind my name. And then I was actually in a position where I could realize it was more than just a career, more than just a lifestyle or the money or being a prominent figure in somebody's community, but actually having the ability to change lives.
Yep.
And so that's why I started growing my passion for the field.
Yes, so I, like Mark, I knew that I wanted to be a dentist around the same age, around 13, 14. And it's actually interesting because it's carnival time now. And somebody very close to me, when I was around that age, we were at a parade and a bead hit her in the mouth and broke her tooth. Okay. And that started this spiral of insecurities about what she looked like, what her teeth looked like, state of her health. And from that point forward, it allowed her to explore the possibility of improving your self-esteem through health, through dentistry. I think that's a very unique thing about dentistry, is that, yeah, we are actually getting people healthier, but we can also make people feel better about themselves and love themselves more. So for me, that was what drew me to dentistry. Like, it wasn't getting people healthy at first. It was about how you can make somebody feel. And so it was a pursuit that I was after since I was about in ninth grade. Went to Xavier, class of 2012. Then I went to Meharry, and I graduated from Meharry in 2016. So I went straight through from undergrad to Meharry, finished in 2016. Did a residency in a hospital in Delaware. We lived in Delaware for about 5 years before moving back down to Louisiana 2 years ago.
Okay. Appreciate y'all sharing. I see y'all skipped the love story part.
Oh.
I'm assuming it happened in Delaware.
No. It happened in Meharry.
Yeah,
At Meharry.
Mm-hmm.
Okay.
I was third year. He was going into his senior year. Yeah. He's a couple years older than I am, but we were only a year apart in school.
much because of the.
Yeah, so he was held
Oh,
back.
nine.
That extra,
Yeah.
that was for me.
Right.
That's right. That was for me.
Oh,
That was
what's
for me.
No.
Yeah, so we met at Meharry, and then he is the reason why I did go to Delaware. I did my residency in Delaware because I knew that that's where he had taken a job.
Gotcha.
Yeah.
Gotcha.
Yeah.
Again, yeah, I appreciate y'all sharing that. I have a similar story as it relates to self-esteem, and it's also related to New Orleans. And I don't know if it was Mardi Gras, but general Mardi Gras energy. I was downtown French Quarter, going Decatur Street. For whatever reason, we decided we wanted to do a piggyback ride race. And I'm a smaller guy and person on my back. I was, a little intoxicated at the time as well, and we took a couple steps. Face planted on the ground. I broke three of my front teeth. I didn't leave my room for 4 days until because it was just around Christmas break, so I got to go home and take care of that then. But I did not feel good about myself at all for several days. So I can understand what she was talking about and the power that has for dentistry.
Right.
So I want to learn a little bit about y'all's careers, your early careers, right? You've committed the first decade, I would say, of your career to public health dentistry. You as well with working in the prison systems and the psych wards.
Yes.
So what got y'all started in those directions? Why go that route as opposed to the traditional, cosmetic dentistry to start?
I'll let you answer first.
Okay, so for me, I'm gonna go back to being a freshman at Xavier, and I think that you can relate to this as somebody who goes to an HBCU, and I know that you can relate to this. When you go to an HBCU, the schools are very mission driven, and they hammer the mission of the school into you, right? And so we know that Xavier's is promoting a more just and humane society, right? Through service or whatever leadership role, whatever you do with your life. And so throughout my tenure at Xavier, I was involved in a lot of stuff. I was involved in a lot of servant leadership. And when I chose the dental school, I wanted to continue that. Mm-hmm. So I don't know how many people look up mission statements of schools that they go to, but I did. And so when I read Meharry's, which is the worship of God through service to mankind, I felt like it was a good fit. I'm like, I like this being of service to people. It makes me feel very fulfilled in what I do. And so I decided to choose Meharry. So at Meharry, obviously our patient population is an underserved population. The people that we serve, there are people who are less fortunate, who can't afford to go to private practice, people who don't have insurance. And so that was just kind of like the story of my life, really, just like being of service to people who needed it. And I had a really great opportunity to go to school on a scholarship that was given to me under the condition that I would serve in public health when I graduated.
Gotcha.
So that's how I kind of fell into it. And I stayed into it a little bit after my commitment was over as well.
Yeah, that's exactly how you got into it. Mine was completely different. I, like most people who graduated dental school, wasn't thinking personally about going into public health. It kind of was forced upon me. And it was a good thing it did get forced upon me because it forced me to grow, forced me to place myself in an environment that was not necessarily what I at the time thought was ideal. But looking back at it, it was definitely worth it. So when I first got out of dental school, I went to a residency in the University of Nebraska, left there after a year, went to Delaware to work in private practice. And while in private practice, there was a situation in private practice where, or not a situation, but more of an opportunity presented itself to the private practice where the state had an idea to contract out anybody that was interested, private practice-wise, to serve the psychiatric community. Okay. That's how it happened. So I was the associate at the private practice. I was the guinea pig, if you will. It was like, well, the owner was just like, you can do it.
Yeah.
I'll guide you into getting in the door. I'll guide you into opening the door for you, but you're going to be serving the community there. I said, it sounds cool to me. So what happened was I would dedicate a few days of my week private practice, the other few days of the week, psychiatric center. And so that's what forced me into public health. My first interaction with it. And it was a great time, man. It's a pretty good time. And I was signed up for a commitment of 2 years. And I think I finished that commitment not in the psychiatric center after it was probably I think maybe 3 or 4 years actually. But it started out in the psychiatric center and it evolved into me working in the prison system. So I left the private practice, but I was still committed to the state in regards to being a member of the can't remember the name of the actual acronym or whatever, in regards to being an employee of the state serving in the federally funded facilities. But nonetheless, I can't remember the name of it, but nonetheless, I still had a commitment that I owed.
Gotcha.
So it's like, all right, you can go back into the psychiatric center if you want, but you also have this opportunity here, you have an opportunity there, and I chose the prison. And when I chose the prison system, it ended up turning from what I thought I was going to do for a year to like 2 years.
Yeah.
And it's actually more fun in the prison, a little bit more fun in the prison than it was in the psychiatric center, to be honest with you. It's a different demographic for sure. But one thing I do really appreciate looking back in that setting, and I'm sure Mia can contest to it too, is a lot of the patients, at least in my experience, very appreciative of the work you were given. Really appreciated the way you changed their life in such a small way, because I mean, the things you were doing were so elementary compared to the type of dentistry that's out there. The levels that dentistry can take. They were appreciative of the most smallest things.
Yeah.
And it goes a long way, because when you do high-end dentistry, those patients sometimes, the expectations are so high. There are limits to even high-end dentistry, that what can be done, you don't even get a thank you sometimes.
Right.
And so, you know, it can make you feel a certain way about it, but it makes you look back on those times and appreciate going through that stint that I guess I did in the federally funded situation.
So, what is the difference between public health dentistry and traditional dentistry? What's the difference in approach, and what are some of the things that you guys will be taking from your experiences into the new practice that you're planning to open?
Some of the things I think are different from public health dentistry to, like, when you say traditional, I would say it would be volume of patients that you see, the demographic for sure of the patient that you see, the need. You would think, possibly you may assume that the level of gross neglect sometimes that you see in people's mouths would change or be different, but no. No, it doesn't matter what socioeconomic background you come from. You're not brushing your teeth.
Nobody brushing your teeth.
Yeah, you're not brushing your teeth. You'll see it all, man. You'll be surprised. You'll see it all. So, I won't say that, but it would be the demand, what they expect you to do in a federally funded situation, the type of not the type of patients, but the amount of patients they expect you to see, with lack of resources.
Yeah.
Yeah. So you have to make something out of nothing, and so it really taught me to be more. What's the word I'm looking for? Innovative, creative,
right,
to make something special happen. You know.
I would add to that one of the limiting factors in public health, really, I wouldn't even say public health, really it's a difference at this point in this conversation between public health and practice ownership, kind of, sort of, is what services you can provide. Like, I worked at certain places that they're like, oh, we don't do this type of procedure, because just like the reimbursement or it just wasn't worth it to the clinic to provide the service. Like, I worked at a place once that would pull teeth. We extract teeth all day long, but did not offer any dentures. So we're like, pulling people's teeth, and they're like, you have to go somewhere else to get your denture.
Yeah.
You know, so like that is a cap as well, because these public health facilities, they get money from the federal government, and the money that they give allows them to significantly reduce the cost to the patient, but it also limits like the materials, the quality of materials, and the services that you can provide to a patient, for sure.
Gotcha. Okay.
Yeah.
And then, so you guys are opening up your own practice soon. Just saw a big announcement. I did feel special that I knew about it beforehand.
Yes.
So
yes.
Thank you.
Throw that out there.
Yes, we're pretty blessed in that regard.
Yeah.
And so we're going to talk about that in two regards. We're going to talk about what that process has been like, from the entrepreneur standpoint, but then also, what are you guys thinking, based on your unique backgrounds, that you plan to bring into your private practice even though it's a traditional
Yep.
private practice that you guys are starting.
Mm-hmm.
What learnings will you guys be taking from your experiences into that to make it different and unique?
Can I answer? Well, go ahead.
Go ahead.
So, one of the things that frustrated me the most as a public health dentist was the health illiteracy with patients. And it's not their fault. They're not educated. A lot of people are not educated about oral health, I should say. Not that they were uneducated. They were uneducated about oral health and really about their health in general. You know, you give them a diagnosis. You know, these patients, they come in with this laundry list of medication. They don't remember the names. They don't know what it's for. They just know it's a pill that they pop. At some point in time, when they got this diagnosis, their doctor didn't sit down with them and explain to them, this is what diabetes is. This is what it's doing to your body. This is what it can do if it's uncontrolled. This is what it can lead to. It's just, that frustrated me. Because you have patients come in and they're looking at you like, okay, like my pressure's high, so what? And it's like, you could die, you know? And so I made it a part of my mission to try to educate my patients in the small time that I had them in my chair, to educate them about what all of that meant. Now, I'm not a physician, and maybe my explanation was not as, you know, medically versed as somebody who is a physician, but I think that was actually a benefit to be able to explain to somebody like what this means. So I plan to take that education piece with me because, like Mark said, the neglect is the same. Mm-hmm. Okay, people might have more resources and they have a higher income, but people still don't understand that. People are still not educated about their oral health and how it relates to the rest of their body or anything like that, because where are you learning it from? You're not learning it at school. Your parents likely didn't know or appreciate or value their oral health. Your doctors aren't learning it in med school, so it's up to the dentist to teach our patients. And that's what I plan to take with me, just making that my mission when I talk to a patient, to make sure that they understand what I'm saying and that they understand the gravity of what I'm saying. Like if you came in and I told you, oh, you have a cavity, that's a bummer, right? All right. But people don't realize that having a cavity is a disease. That is a disease. People don't get it. They don't understand it. So I'm getting a little passionate.
No problem.
I'm getting a little passionate because it's a frustrating thing for me. And so again, that's what I plan to take with me for sure.
That's a good plan for sure, and I piggyback on that as well. I'm in concurrence with that, and I feel like not only will I take that same passion and bring it to our practice, but you know, a little bit of things that fire me up about it is in the public health setting, like I was expressing, a lot of volume. You had to see a whole lot of patients because you had to get them through. Not having enough time to really have that relationship with them and express to them the importance of this, that, and the third. Now, we may not be heart doctors. We may not be pancreatic doctors, liver doctors, lung doctors, or whatever the case may be. That may not be our specialty. But it doesn't mean we don't know or had to know a little bit about it, enough to be more than average, if you will, in the education about it. That we can't sit down and have a heart-to-heart conversation, a relationship-driven type of practice, I think is where we're going.
Yeah.
Because having 15 minutes and having that conversation with Miss Smith or Mr. Jones or Dr. Bobby in your chair, whoever the case may be, and have this heart-to-heart and try to explain to them the importance of why this is something they need to take control of, and they can control it, is what differentiates our vision of what we want to do with our practice, what we were allowed to do in the public health setting. And another thing that I think I would personally take also is the relentlessness that I gained when I was in the public health setting. To literally want to provide, even though it was being told no. I don't know. I was always coming home complaining at dinner and stuff like that about being told no by the higher ups. No, we can't order this material. No, we can't do this procedure, doc. No, we can't do that. And trying to find a way to be innovative and make it happen regardless. Yeah. Doing it even though they told me no. And when the case got sent off to a certain lab, paying for it myself, like coming out of my own pocket, making the credit card payment or whatever the case may be myself, just to give this patient or this group of patients a higher end level of care that I know that I would be giving them if they would just come see me in my private practice. Because I told you I was working private practice here for a few days and then working in this setting for another few days. So I was just trying to give them what I know was actually better than what we could offer. So I'm gonna take that same philosophy and that same belief to my private practice setting, trying to give the best.
I want to pivot a little bit now to oral health as it relates to general health. I read a statistic before our conversation that 98% of people who have type 2 diabetes develop periodontal disease.
That's
Is that accurate?
definitely true. When I was in school, it was like 80%. But if the numbers are that high now, I believe it. Because honestly, you see the connection rampantly everywhere. It's just almost like you almost want to feel like nothing's definite, but you almost want to feel like it's almost 100%. The connection and just systemic connection between one's body and their oral health is just
starts in the mouth.
Yeah, it's just ideal.
It starts in the mouth. I think people don't view their mouth as a body part, and they certainly don't view their teeth as a body part. People be like, extract it, pop it out, don't care. Like, it's like losing a finger. It's like losing a toe. People just, they don't, they
or
just
they think
don't see it.
it's going to grow back. Or
So-
something of that nature. Like,
Really?
I'll get another one maybe.
Well, no, honestly, people do. Some people, it's not an overwhelming majority of people that think another tooth is gonna grow, but some people do.
Really? Okay.
Yeah.
They treat it like another one's going to be given to them.
Yeah, or they, you'd be amazed at how people can adapt and what they can live with. And I mean, you have people who have no teeth in their mouth who can eat corn on the cob. People who do it doesn't mean like that.
They gotta be from Louisiana. That's just my guess.
So to go back to your question about the diabetes thing, like if you think about it, diabetes is an inflammatory disease. Right. Periodontal disease is inflammation of the gum tissue. What happens after that is you lose the gum tissue attachment to the tooth and you get bone loss. And so now you have no support keeping the tooth in place. And now the teeth get wiggly, bacteria, plaque, all of that gets stuck in between the tooth and the gums because the gums are no longer attached to the tooth. And now you have fetid breath, you have bad breath, you have mobile teeth.
That's the technical term?
Yeah, it is
Fetid?
actually. Fetid.
Y'all got that?
Yes.
Fetid, okay.
Yeah, and you're losing your teeth, right? And so if you're a diabetic, I know type 2 at least, is people get it because of their diets. Mm-hmm. So now imagine you're losing your teeth. You have less teeth now. You can't eat well. The quality, your chewing efficiency has decreased because you have less teeth. So now what are you consuming? You're consuming foods that are a lot softer that you can just swallow, but they're not necessarily healthier foods for you, right? You're not eating salads. You're not eating things that require teeth.
Yeah.
And then that leads to having some type of digestive issue because you can't chew your food,
So it all plays back to it, man. But even with diabetes, a lot of the research is going back into the heart.
Yeah.
A lot of the connections through the heart or through the mouth getting to the heart. It's just a relationship, a very strong relationship, and a lot of people don't understand that. It's not being taught. There was a book that a mentor of ours recommended we read back in the day, and it was a very interesting book called Beat the Heart Attack Gene by Dr. Beal. And the book literally talks about the systemic relationship between the mouth and the rest of the body. And he's a physician. And of course it was talking about other relationships, but the first chapter, and the biggest thing he said in the book was about the mouth. And I can't remember the quote exactly, but it was something like, all good health
starts with the mouth.
Yeah. And every dentist needs to know that line. All good health starts with the mouth. And he's a physician who knows what he's talking about because the book is encompassing so much lit reviews and so much literature, statistics, and this and the third, and how they all interact. Yeah. And it's a big deal. And a lot of people, like Mia says, and it really pisses her off a lot, they literally treat their mouth like it's not a part of the rest of the body.
Yeah.
And so when you have an infection in your body, and I think it's a big deal right now, especially coming out of COVID-19, your health being a big deal.
Yeah.
I think we're going to hopefully have a trend and a generational shift where everybody starts wanting to be more healthier, especially in the Black community. We need it because we were the ones getting our butts kicked the most regarding the COVID-19 situation. Yeah. And everybody generalizes their knowledge about what they have conceptualized about COVID-19. We think we know, but there's still so much we don't know. But nonetheless, what we do know is people that were beating it were healthy. The people who were suffering and unfortunately dying were unhealthy and had somewhat systemic condition, some underlying condition. And man, it sucks so much, but it was the reality behind it. And hopefully that situation of COVID-19 that still plagues our country to this day, and definitely our community as African Americans, it wakes us up a little bit in understanding how important the rest of our body plays a role to diseases that come in and affect us. So I'm gonna tie it all back to, if our body were to have what we call an immune system, which is like an army that fights all the wars, all the viruses or bacteria that come in contact with us. If this army is basically fighting a chronic disease such as diabetes over and over every day, day in and day out, from the time you go to sleep to wake up, fighting heart disease, fighting some type of inflammation over and over, it's fair to say that that army of ours, or our immune system, is compromised, right? If you have a compromised body busy fighting a war on this side, it's very easy for something else to sneak attack it from the back, i.e. COVID-19. So the way we relate it back to the health of your mouth, if you have Mia, speaking of periodontal disease, what we call periodontitis, it's really an infection. And so if your body's constantly fighting this infection over and over all day long, and the sad thing about infections is most of the time they don't hurt. So we don't pay attention to things that don't hurt us. But if it's fighting this battle all day long, you're more susceptible to having real problems such as diabetes taking you out. Yeah. You're more susceptible to having real problems of heart attacks or strokes taking you out, COVID-19 taking you out, anything of that nature taking you out because your immune system compromised. So I think if we focus more about our immune system, about getting that healthy and keeping that healthy, things will be a lot better. And it all starts in the mouth, like me and Mia truly believe and attest to. You know, research shows. But yeah, that's just my 2 cents on the whole connection, man. And, you know.
So, what's the blueprint? How do you, since overall health does start in the mouth, I learned that today. It's new to me. What's the blueprint? How do you take care of your oral health?
Well, the blueprint for me is fairly simple. I say it's simple, but I'm human, so I don't follow my regimen all the time, but, you know, follow it daggone majority of the time. It's very rare that I don't. You always got to brush your teeth twice a day. Mia's way better at it than me. In fact, I don't think I've ever seen her skip a day.
I've never seen you skip a day.
Well, I'm talking about...
You said that was fetid breath?
Fetid odor. Mark has never had fetid odor. It's
Okay.
like, I don't even think this man has morning breath. So listen to him. Listen to him.
She's lying. I'm here to contest that's not true. I'm not a superhuman or anything like that. But nonetheless, the routine is simple, man. It's just brushing your teeth twice a day. Before you brush, first thing I do is always floss. I floss first because your toothpaste is medicine. I have to explain that to my patients because sometimes patients think that toothpaste is just to make your breath fresh. But it's medicine. There's sodium fluoride on the back of the bottle or the back of the tube for a reason. It helps strengthen your teeth. It helps strengthen your enamel. You don't want to brush your teeth if you just ate a burger and you got burger in between your teeth because now you're medicating food instead of medicating your teeth. So I like to floss and get all the debris out of my mouth in between the nooks and crannies out first. Okay. All right, that's my go-to. I floss first. Then I like to rinse because I don't want to wash away all my medicine either. So you rinse your mouth, get it going, and things of that nature. Then I go to the brushing, and I let the medication in the toothpaste literally encompass my mouth, man. Mm-hmm. Literally. And I don't rinse like I used to when I was a kid. I would take water and rinse my mouth and spit it all out. You just let it be. Spit it out. I know it sounds nasty. You spit it out, but that medicine, you want it to stay in there and you want it to marinate on your teeth. You want it to fortify your teeth. And The most important thing, my secret weapon and why my breath doesn't stink, according to my wife, is just my tongue scraper. Yeah. It's very nasty if you're not using a tongue scraper. Now, however, what makes me upset about the tongue scrapers, and I tell this to my patients all the time, you go to Walgreens, you go to Walmart, you go anywhere, a convenience store, you go to the toothpaste aisle, and you get your tongue scraper. The way they make the tongue scrapers are very frustrating. There's so many plastic tongue scrapers out there. They're not strong enough. Some toothbrushes try to, they gotta meet you they gotta meet you halfway. They gotta meet some people halfway. So they add it to the back, and they got those little bristles on the back.
I've used those before.
They're not
It's
as
better
efficient.
than doing nothing.
It's better than doing nothing, but it's not as efficient as it should be. All right, because believe it or not, your tongue, those little papillae on your tongue, or what do you want to call them?
Taste buds,
Taste bud, whatever. They're longer than those little bristles, man. You need something deep and strong. My professional recommendation: a metal tongue scraper. $3 to $7 off Amazon. Get you a metal tongue scraper. Find it. Get it to the house. Be your best friend. And you also notice when you're using it, God dog, this thing's efficient.
Yeah.
You will really get to see. You will really get to see some of the stuff coming. Like, man, I can't believe that this is still on my tongue.
Yeah.
I ate this chocolate like 8 hours ago. Why do I still have chocolate on my tongue? Because it gets embedded into the little nooks and crannies of your tongue. Believe it or not, man, and that's what can cause a foul breath. You got a tongue scrape, man.
Yeah. And
that's my secret.
And the bacteria that's on the tongue can also cause the cavities. It can also cause the gingivitis, which leads to periodontitis, periodontal disease. I want to add, in addition to just having an oral hygiene routine, because actually seeing a dentist.
Yeah.
Minimum of twice a year. It's just 2 times a year. Just 2 times a year. 2 days out of 365 days is all we're asking.
Yeah.
That's it.
1 hour out of that.
Right. That's
1 hour.
it. That's it. So, like, don't try to be your own doctor. There's a space for anybody, whether you're a college student that doesn't have a lot of money, whether you're lower socioeconomic class, where you know, every dollar, like, counts, you know.
Or you're higher end and you're just too daggone busy.
You
can't make the time.
There's a doctor for everybody everywhere.
Yeah.
You don't have to go to, you know, a Beverly Hills doctor in order for you to be healthy. You don't have to, but you do need to see a dentist. Yeah. You have to.
Yeah, could you speak a little bit about oral health for kids? You guys have 2 kids of your own.
Mm-hmm.
You know, I tried to brush a toddler's teeth before, and it's
impossible.
Challenging.
That's
usually led to eating toothbrush. Like he liked the toothpaste a lot.
Oh my God.
They
like to swallow it. Yes, yes. Okay, I'm going to answer. First, I have a pop quiz for you.
Okay.
What do you think the most common childhood disease is?
I was going to think of something like a virus, like a
You can say whatever you think it is.
Flu, or these common, or not COVID.
That's a good answer, but actually the answer is cavities.
Cavity.
The most common childhood disease. Remember, I told you a cavity is a disease.
Mm-hmm. Yeah.
The most common childhood disease are cavities.
Yeah.
So, I just wanted to say that. But also, yes, so kids, Mark actually is the oral hygiene. Yeah, I make him do everything because my kids, they're pretty good now. But at some point, like, they like to kick, they like to throw. Look, I'm not. We have to hold our kids down, and I tell parents all the time because nobody wants to feel like they have to hold their child down, right? And I'm certainly not going to do it. I will not hold a child down in the office. I'll hold my own children down, but I will not hold another person's child down in the office. That is why pediatric dentists exist, and there's a special place in heaven for those people. But your child does just not have the manual dexterity to take care and brush their teeth the way they're supposed to. So you're going to have to do it for them.
Yeah, so this is what...
And you're going to have to hold them down.
This is what... Because I'm the one that lives it every day. I know exactly where you're coming from. Extremely hard. I think every parent can contest. Brushing a child's teeth, and you know it has to get done, is one of the things you look not forward to every morning or night. You're just literally loathing the thought of it.
It's easier not to do it, and that's why a lot of people defer to not do it. But
so I remember when I first started, I had my first child ever. It was the first time I had to brush someone's teeth. And it was so impossible. I reached out to one of my colleagues and frat brother, who's a pediatric dentist. I was like, man, Flex, I hate to bother you, man, but I really want to know, how am I supposed, because I can't be doing this right, because it can't be this hard. How am I supposed to do it? And so he literally got on FaceTime with me and showed me how to brush a child's teeth. And you have to lay them down supine on their back, and you are literally supposed to take your left leg and your right leg and put it over their arms. So they're literally laying down like this. This is from a pediatric dentist who's a specialist at doing this.
That's why kids don't brush their teeth now.
You have to hold them down like this. So they can't move. They're locked in place, and your legs are just literally on top. And you literally sit on top of them. Their head is in between your lap, and you open their mouth, and you gently just start brushing their teeth. You want to hold your toothbrush with light grip. You don't want to like grip it hard, because if you grip it hard, you're brushing hard. Mm-hmm. You want to grip lightly and gently brush their teeth. So we're just removing the plaque. And try your best at it. And they'll eventually get more and more efficient with it, and everything gets better. Okay. And that's what I started doing to our son Junie, and brushing his teeth wasn't as hard. Like when I actually pinned him down, I was like, oh, I got control of him now. He couldn't go anywhere. He opened up, and they finally stopped fighting.
Yeah,
they finally, with their arms open, they're just like, I can't do anything. So they just give up. They open up, and they get it over with. And it becomes a routine. Mm-hmm. And the question comes up sometimes, too, with the patients, when do I stop? When do I let them go on their own? Now he's 4, he's 5, he's in kindergarten. I tell patients, and it was taught to me by a doctor friend of mine who expressed, and it made sense, if the kid cannot write their own name in legible handwriting, and they can't write a sentence, or they don't have the dexterity skills to draw or write, they shouldn't be brushing their teeth yet. So no matter, there is no age. It's really the dexterity skills. So if your kid, unfortunately, is 7 years old, but they still cannot read, I'm about to say read or write, but they still cannot write well, you should still be brushing their teeth. Okay. Now, at that age, you shouldn't have to hold them down, arms open like that. No. More so for the toddlers, but still, you should be brushing their teeth, because more likely, 9 times out of 10, they're not doing it efficiently enough, so you can't be surprised when you come see somebody like ourselves and we tell you there's a cavity here and there. And you looking at them like you're mad because you're not brushing their teeth well enough, but they're at a disadvantage until they can write their name. So that's my go-to. That's what I tell patients. Yeah. There's no age.
In addition to that, we learn to give what's called anticipatory guidance to parents when they come in for their visits with their children, which is just like more so for the parent than the child, helping them and giving them guidelines of like how much juice you should allow a child to drink a day, not letting them sip on juice all day. If they're going to have the juice, have it at one time in one sitting. Don't let them graze all day. Don't drink a bottle at night. Don't let them sip on it, like that type of thing. So it's more than just like, oh, brush their teeth in the morning. It's all about like lifestyle and diet and things like that as well. But yeah, I worked at this immigrant clinic. It was a predominantly, like, I don't know the actual statistic, but I'd say like 99% Hispanic population that I served. And most of them were immigrants. And the amount of children that I would see that would just have rampant decay. Every tooth in their mouth would need to come out. And it was just because their parents just didn't know any better. And I mean, it wasn't just a lack of them brushing their teeth. It was what they allowed them to drink and to eat and things like that. So it's really, really important. We're sitting up here joking about pinning them down, but you have to do it. You gotta do it. You have to do it. You have to.
If the specialist told me to do it like that, I'll pin them down. That's how I do it.
Yeah, and it does get easier. And you can make it fun. Like our kids, like when you sing to them or whatever, it makes it easier, but it is stressful. And that's why parents try to avoid it, because they're like, they just kick, they're upset, I don't want to do it. But if they come to the dentist and they need teeth pulled or they have an infection, they're going to kick and scream then too. So get in a routine, they get used to it, and it's not so bad.
Yeah. So what are some of the long-term consequences of untreated cavities, for example? I know some people would go to the dentist will tell them they have a cavity, and like, oh, okay, well, I don't feel like paying for that right now, or whatever it may be. Like, why is it so important to take care of that immediately instead of letting it linger?
So the disease process of a cavity does not stop. So if you don't treat the cavity, if you don't treat the disease, it's just going to continue to erode the tooth, eat away at the tooth, rot the tooth out. That cavity will then reach the nerve that's inside of the tooth, and it'll affect the nerve. You'll get an abscess or an infection of the tooth. That abscess can cause quite a bit of pain. It can cause quite a bit of bone loss, a lot of inflammation and infection, but it can also go to other places. Like infections in the mouth do not just stay in the mouth. If you let it go long enough, and I swear to you, you can't make this up. On Monday, I had a patient come in. He was like, my tooth is killing me. My tooth really hurts. He only had 4 teeth left. So he doesn't have a good history. He has a history of neglect. He's not very motivated to take care of his teeth at all. So when I was looking at the x-rays, I didn't see anything like, I saw a lot of decayed teeth, and I'm like, okay, well, that's why the tooth hurts. I looked at the x-rays before I went in the room. When I went into the room, I could tell that his chin was very, very red, and it was affecting the way he could talk. Like his lip was kind of like it wasn't moving on one side. And I asked him, I said, does your chin hurt? And he was like, yes, it's killing me. It's killing me. So we took a CT x-ray, and I could see that this infection from this one tooth went to his chin. And then when I went to take the tooth out, the infection started draining from his chin. It was a very cool thing to see.
Cool.
For me.
Okay.
It was a very cool thing to see, but it was also just like, wow.
Yeah.
It will take over your body.
It will take over. My neighbor next door, he had a tooth that he let go bad. The infection traveled to part of his brain and killed him. Like.
And a lot of people don't understand that or believe it, but
yeah.
the way it was taught to us in dental school, Dr. Jackson always made it a point to literally hammer home your mouth is literally a hand's length. So if you put the bottom of your thumb, the bottom of your mouth, a hand's length away from your brain, and if you flip your hand down, a hand's length away from your heart. So bottom tooth, the infection more than likely is going to travel, and it is traveling. It's already in your systemic system.
It's in your bloodstream.
It's in your bloodstream. The infection is in your bloodstream, and your immune system's fighting it all. But I'm talking about travel to the point where you die. And people don't really like to hear that because they really don't believe that people actually can die from a toothache. Modern medicine, since the 50s, when penicillin became a real thing, and antibiotics and things of that nature, help minimize death from teeth. But man, it's still real.
Yeah. It's
still real. The infection can really travel. And working in the hospital setting at the University of Nebraska, I've seen a lot of unfortunate infections. Private practice, still saw infections. You just see infections, man. You just see them, and they all start in the mouth, and they come from gross neglect.
Yeah.
You let a cavity sit too long, it spreads, and it continues to spread, and it doesn't bother you until it starts hurting. And by the time it starts hurting, it's probably too late. But the funny thing about it is you have people with a lot of high pain tolerance,
yeah.
and it hurts, and then it stops hurting. So they go through like, oh man, I'm good. I made it through 24 hours of the pain. Yeah. And it doesn't hurt anymore, but the infection's still brewing. It's getting harder and harder.
Yeah, once the pain actually goes away, it's the
problem.
worst.
It's a real problem because it's starting to eat away at the bone. And people don't understand, patients don't understand how much it eats away at the bone until you actually, thank God for the technology now with the CBCTs. You can actually show you what your skull looks like. And when you look at your skull, we show you your mouth, and you see this big old hole right here. Like there's literally like a gunshot wound going through. You can see the other side of the bone on this side.
And people sometimes don't even feel this.
No, they don't feel it.
They don't
know it's there. They know they gotta get teeth pulled, but they just don't know it's brewing or sitting there. Like,
yeah,
what
like
is
they
this?
don't feel the pain in the tooth anymore because the nerve at that point is
It's
dead.
dead.
It's no longer alive.
Wow.
So what brings them in is like this inflammation and this pain that they're feeling. Like the gentleman that I helped earlier, he was having all this pain here, you know, and he related it to a tooth because he knew he had pain in the tooth at some point. But it becomes like it's this swelling of bacteria and infection. It's all this pus trying to find a way out of the body. That is what's painful.
Yeah,
that inflammation, that swelling, that pressure of just this infection trying to find a path out. That's what brings them in.
Mm-hmm.
So what works as far as intervention to help people prioritize their oral health? What is it? Education? Is it?
I really think it is a lack of education. So I think more education.
Multifactorial.
It is multifactorial, but education, culture, better understanding, finances,
Putting some
fear.
respect on your teeth. Put some respect on your mouth.
Fear. I think fear is a big deal. A
Yeah,
lot of patients.
that too.
When I was working in Baton Rouge for the last 2 years, fear is what
Yeah.
kept a lot of people out. That people don't talk about.
Afraid.
There's a lot of things that keep people out. Fear, money. What else? Talk to me.
That's really the top two.
No, there's like 3.
And you know what's
Can't think of all.
interesting about the fear bit is the fear is what keeps them away. And they're afraid because every time they go to the dentist, they have to have another tooth pulled or something drastic done, but it's because they stay away.
Yeah.
You know, if they were to go routinely and see someone, you can catch these things before they get invasive. And going back to the question that you asked earlier, why is it important to take care of it right then and there? Because if we catch it early enough,
Simple procedures.
it's simple, it's less invasive, we don't have to remove as much tooth structure, we don't have to remove a tooth. It's less invasive. If you wait too long, then every time you come into the dentist, it's something invasive. It's something psychological. It's a psychological thing to lose a tooth. And you know what I mean? And so if every time you come to the dentist is a bad experience because we're telling you, hey, you have an infection here, you need a root canal, we have to pull the tooth, people are afraid because their circumstances, their experience have been bad experiences every time they come in. So that, I think fear is a really, really driving thing for sure, especially people of lower socioeconomic status because they don't have the privilege of seeing someone routinely. So whenever they go, it's another tooth, another tooth, another tooth, you know?
It's an emergency.
It's always an emergency. Yeah.
And so, like I was saying, it was fear, money, time is an issue with a lot of folks as well, making the time to come see us. And those are barriers.
Just the lack of, like, the health illiteracy for sure.
Yeah. So those are barriers you gotta overcome. You gotta address the fear. We can address that with sedation. We gotta address, it's true. We can put you to sleep. I tell you I'm gonna put you to sleep and then you wake up and everything's solved. A lot of patients are like, well, say no more, doc. I'll see you tomorrow morning because I know I gotta get it done. Money, that's an issue or barrier as well. We can address that. And then time. You got to make time in the schedule to, have this done. So when you tell the person you can get it all done in one day instead of having to come back multiple times, 8 visits, 7 to 8 visits just to get, back to where you got to do is come in and see me for cleanings. Mm-hmm. That's a lot. That's a lot of asking somebody, you got to see me 7 or 8 times this year. That's a lot of ask.
And I always tell this joke is that dentistry is like the only career that we try to put ourselves out of business and we'll never be out of business. Like we want to only see you twice a year.
Right.
We really do. We don't want to see you 6-7 times. We really don't want to have to do these things to you. We really want you to take care of your teeth to the point where you don't need us, but it'll never happen. So
I read something one time that dentists deal with a lot of mental health challenges.
Mm-hmm.
Heard that there were even high suicide rates among dentists, but I never understood what was driving that. Do you guys have any insights on what might be driving that?
I think burnout is something that really, really pushes a lot of dentists over the edge. Burnout is very real. The demand, especially in a public health setting that you have to meet, the amount of patients you got to meet, the amount of people you want to save, change their lives for the better, becomes overwhelming, and so burnout, even if you're in a private practice setting, not having control of your schedule, even though you are the boss and you can control your own schedule, having a hard time saying no. I can't see that person at this time. I can't work through my lunch. I can't come in on Friday or Saturday or even a Sunday to save this life today. And just saying no, a lot of us have a hard time because we put on this cape to be dentists to answer that call. And, it's hard for us to say no sometimes, and that kind of catches us up. What else psychologically?
I think also you have patients who come in who are afraid of you, who tell you, like, I don't like you, I don't want to be here. Like, that can be a lot mentally. But then a lot of the things that we do inflict some amount of discomfort or pain on a patient, whether it's just giving the injection or whatever. you know, like if you do that, I do that every day, all day, you know, and so like that can kind of be a little disheartening. So you know, you're in this to improve lives and make people better, but a part of your job is making somebody uncomfortable for a certain, you know, a moment throughout the procedure, and yeah.
What else can lead to it? Finances. Being in over your head with your business. Lack of entrepreneurial intelligence, I guess. How to run your business can lead people to suicide. Not wanting to come home, like, man, I just can't do another day of this.
It's hard on the body. It's a very laborious job. Your back, your neck.
Yeah, you don't get that, especially a lot of the dentists in dental school, because majority of the demographic in dental school is young, under 30. Majority. There's still people in school 40, 50, I don't know about 60, but they're up there.
Yeah.
All right. But they're probably like 1 or 2% of the class population. So when you're young, you're like, man, I can go work out, I can go do this, I can go run a mile, or I don't even have to live a healthy lifestyle at all, and I just bounce back, and this doesn't hurt, this doesn't affect me. And because you're out of shape, or because you're not living a healthy lifestyle, by the time you get, my age, 37 now, and 50, early 50, it becomes very laborious. It becomes very taxing on your body. Your back goes out, your wrist hurts, your hands cramp up. Man, playing with your kids start feeling like, a challenge with you, man, because it starts to catch up with you, and you really start to feel that out of shape feeling, because the job is very strenuous. It's a young man's game, even though you got a lot of old docs still doing it.
Yeah.
So, but in regards to answering the question about the psychological aspect of why some of us take our lives and why we do it at such a high rate, man, there's just a lot going on in the field of dentistry. And I also think, I don't know the statistic, but I think we have a high divorce rate as well, unfortunately. And that can take a toll on somebody. Male, female, doesn't matter, psychologically. Make you want to end it, There's a lot of, I think.
When you work with people and you interact with different people, like every hour you have somebody else that you're interacting with too. I just feel like when you're drawn to people and you work with people, a lot of that can kind of ruffle your feathers sometimes too. Yeah. Especially people who are not incredibly grateful for what you're doing for them.
Yeah, feeling undervalued can psychologically take a toll on you. It's a lot, man, but you never know what somebody's going through and why they decide to take their life. It's a lot going on, man. I think every case is, individual case, and everybody has their own personal reasons and their own personal demons they got to deal with.
So, on a more positive note, what are you guys looking forward to most in launching your new practice?
I'm looking forward to working with him. We've never worked together.
Really?
Never.
Okay.
Yeah.
Okay.
Yeah, so that's fun.
I think what I'm looking forward to is having the opportunity to enhance people's lives, improve lives for sure, and be in control of it. Be in control of it this time. Enhancing lives, improving lives through the oral cavity and through oral health in our community, and this time, run the show.
Yeah. Do it the way. Practice the dentistry we want to do our way. Use what we want to use, the materials, the technology, without having to answer to somebody.
Yeah.
Yeah.
We have to answer to each other.
Yeah.
Right.
I gotta ask her. Yeah.
Good luck, Mark.
Yeah, I know.
What are some of the services you guys are going to be offering besides general dental cleanings?
Oh man, we're gonna be offering a whole gamut of stuff, man. Of course, besides cleanings, we're gonna be offering fillings. We're gonna be offering crowns. We're gonna be offering smile makeovers through veneers, smile makeovers through dentures. We're gonna be offering high-end dentures, middle-end dentures, low-end dentures. What else can we offer?
Implants. Literally rehabilitating somebody's mouth, full mouth implants. That's like his thing. Can't believe that's not the first thing you mentioned.
I was trying to be humble. But yes,
tooth replacement through like
it's
through something that will last you the rest of your life.
If you keep up with it and take care of it,
Dental
yes,
implants.
Right.
it lasts you a while.
Yeah.
So I've been on Instagram a bit, following healthcare providers, a lot of dentists, and I've seen people drilling into drilling into bone. The whole mouth is bloody. Like, that's all I needed to see to be like, I'm gonna just take care of
Right.
the teeth that I have. But like, I don't think that people generally look at dentistry and think surgery.
Yeah.
Right.
And so,
which is interesting because our degree, DDS, is literally has the word surgery in it. Yeah.
And some of these posts are definitely confirming that.
Yeah. And so that's the type of dentistry we will offer.
Invisalign.
Those deep surgeries, and then less invasive like the Invisalign.
Yeah.
And
everything. Botox.
Yes.
I got you if you want some Botox. You see me.
I hadn't thought about it, but I'll consider it now.
It keeps you young.
he looks young. He doesn't need it.
That's how you look. You stay young.
Well, yeah. So you stay young. Maintain it.
Got it. So, last question I have for you guys. It's a question that we ask all of our guests.
Oh, I don't mean to interrupt, Kwame, but
No problem.
there is a new technique that Mia just learned. That is another procedure that we will be offering, and the only ones in the state that will be offering.
Okay.
Yeah.
That definitely affects our community as African Americans, which is melinated gum tissue.
Mm-hmm.
Okay.
There's a lot of melinated gum tissue that is harmonious, that is the shade it is, from the back of the mouth to the front of the mouth.
Diffuse pigmentation.
But when it's diffused, those patients are a little bit more self-conscious of their gum tissue. When they smile, they may smile a certain way. They may carry themselves a certain way because they don't want their gum tissue necessarily to show. Because the neck of their tooth, the gums are pink, but the higher up they go, it's a little bit more melanated. Mia has learned a new technology that can now transform the shade or the pigment of your tissue and make it all uniform.
Wow.
Make it all one color. Preferably more so pink, but it's not a guarantee, but it does make everything more uniform in color and shape. Not shape, but color rather, and appearance. And I believe the only one in Louisiana. I think you're the only one. There was 11 doctors that went and learned this from Dr. Stanley. And out of the 11, Louisiana, I don't know if there was any other states that were like double states, like people coming from the same area.
No, it was so random. It was all over the country, but it was just 11 of us.
Yeah.
Mm-hmm.
Only one in the States, so we're going to be offering
Bright gums. It's called Bright Gums.
Thank you.
It's a gum pinkening procedure. It's not like a tattoo or anything. And I just want to say there's nothing wrong with having pigmentation in your gums. There's nothing, it's not a disease. It's not anything that's going to turn malignant or into cancer. There's nothing wrong with it. We all have different levels of melanin, but some people are insecure about it. And like I said earlier, dentistry, we have this gift of being able to heal people in their health, but also in their self-esteem.
Yes,
and so that's just another service that we'll be offering to make people feel better about themselves, elevate their health and their self-esteem at the same time.
Yeah, well, congratulations on that.
Thank you.
Yeah.
Thank you.
But yeah, so like I was saying, our goal at Bear is to make health part of Black culture.
Mm-hmm.
Right? We want health to be the standard in the Black community. What does that mean to you, and what do you think it will take to make health part of Black culture?
I think that we need to see more people like us, that look like us, as doctors in the workplace. You don't even have to be a dentist. You don't have to be a physician. I think that it's going to be important that the team members that we hire look like us. Not to say that we're not going to hire people who don't, but I think it's important to have those people in our office. So when they can tell their family what they're learning just by working with us, you know, like you're a healthy guy, but there's a lot of stuff you didn't know, right? And it's the same thing for people who, like, it's just like that. It's like an epidemic of not understanding what oral health is. So having more doctors, having more people in the workplace, getting our team members that look more like us, bringing more of their family and friends in, just seeing that Black people do care about oral health, or health in general. I think that that's a way that we can do that for sure.
Yeah. So like what you're saying, I think the answer is influence. Having a lot more influence. And how do you influence our community? Media. How do you influence our community in the church? How do you influence our community in the classroom? Um, Athletics. What else? I just think there's just so many media outlets we can reach, and the more the word gets out that health is a standard, the the more
Everybody's doing it.
yeah, the more um, the more well off we will be as a community. I mean, honestly, the the generation, like I was speaking about COVID-19 earlier, needs to shift. And I was explaining to Mia earlier, in our community, I feel like all of us want to break our generational uh, wealth disparities, our generational wealth gaps. We want to close those gaps in our community. I mean, everybody knows statistics about the African American community and how much money our community spends versus how much money our community actually owns compared to other ethnicities and races. And if we were to take that same energy or have the influence to take that same energy, where I don't want to be the first one in my family to make a certain amount of money, I want to be the first one in my family to be healthy, because each and every one of us, I'm making the assumption, in our community knows somebody who has diabetes, knows somebody with a heart disease, knows somebody close to us who's suffering or fighting this chronic illness, whatever it may be. And we treat it so normal.
Yeah.
We treat it like it's a normalcy in our community, and we treat it like, oh, everybody in the family got diabetes. I guess it's my turn. I'm 43. I guess it's my turn now.
It runs in the family.
It just runs in the family. It's genetic. And just like the book I was talking about earlier, Beat the Heart Attack Gene, everybody thinks it's genetic, and like they don't have any type of control, but we do have control. And I just think if we had the same influence and we had the same motivation that we do to get the wealth gap closed towards our health gap, we'll be better off.
Yeah.
And I think that's how we can address the community. And hopefully, like I said, this generation takes it up a different notch, man, than what the previous generations were doing in regards to our health. Because me and me were talking earlier about what our lifestyles in our community, what we decide to eat, what we think is cool to eat, what we enjoy eating. Hell, excuse my French, what other cultures love about our foods and love to eat, because they enjoy eating it as well. But man, we made it a lifestyle. We eat this thing almost every day. It's not just special occasions. It's our culture. Yeah. And when that starts changing, and I see it changing, I believe the trend is going in that direction. I mean, we got so many vegan spots now. I think what was a popular one in Atlanta, Slutty Vegan, I think is the name of it. I think hers is really going mainstream, man. Yeah. Like everybody wants it. Her whole business aspect is getting popular off eating healthier and making it soulful as well. Mm-hmm. And so, I mean, the more our demographic and the more our community starts changing and shifting our mindset, I think the whole health wave is actually taking off in this generation, and I think it's going to get better. I hope it gets better.
Yeah. And I think I took for granted being at a double HBCU here and then at Meharry that all of my classmates pretty much looked like me, right? And so, and then people here, everybody wants to go to pharmacy school or go to med school. And so you think like being Black and being in healthcare is like a thing, and then you get out in the real world and you're like, wow, it's really, really not. Like there's not a lot of us. Like we really are a minority in every way, even in our careers. Really do think representation is a good way to get people to care about it, to make it a part of the culture, and not I don't want us to be a minority anymore. Where our practice is going to be, we found out that there's another African American husband and wife couple that's going to be moving like 2 blocks away. And then a friend of mine just told me she's opened an office another like 2 to 3 blocks away. Now, a lot of people might be fearful of that. I'm a strong believer in there's food at the table for everybody. But that's what I want to see. I want to see more people on St. Charles Avenue having dental offices that look like us. More Black people. Black people want a Black doctor, So if there are more Black doctors, there's more patients that we can treat. So I think that representation is a big part of it as well.
I wanted to add an additional comment. I was afraid to share it at first, but so I haven't had a cavity in over 10 years.
Nice.
Right, I'm pretty proud of that.
Yes, you should be. You should be. You're doing something right.
I don't know how uncommon it is per se, but I like to attribute it to my diet. So I eat a plant-based diet. I started in undergrad, so around 2013, 2014.
Oh, wow.
So how do different diseases affect oral health? This will be we'll close out with this. How do different diets affect your oral health? Even diets that people might be considering healthy.
I think different diets, well, the Western American diet, if you will, because when we say Western, we all know you're talking about the United States of America.
Right.
Our diet's just full of carbohydrates now. You can't get rid of it everywhere we go. And then when you try to break it down and you try to eat healthier, those sugars always find a way to interrupt. So I applaud you eating a plant-based diet. I know it's not for me.
You.
It's not for me.
I knew he was going to say that.
It's not for me. However, I don't think there's anything wrong with it. And I do think it is attributed to the fact that your teeth are so healthy. And it's probably why the rest of your body is so healthy as well. I know as a professional the type of foods I eat, and I have more of a sweet tooth than Mia ever will. I put myself at a higher risk for the cavities. So I have to do, if I'm going to eat these foods, I have to do what I need to do to stay disciplined enough to make sure that my oral hygiene regimen is commensurate to what I eat, I guess. If I'm eating like this, I daggone better not miss a day. I daggone better not miss 2 times a day. You understand what I'm trying to say? Or flossing for sure. Because that's where a lot of the patients get their cavities, is actually in between their teeth. All right? A lot of people are like, man, how are that cat? They're in between your teeth. I'm flossing, but are you flossing correctly? I'm brushing, but are you brushing correctly? You know what I mean? Like if you're brushing, but you're not brushing the right way, it's not efficient. You still got the same, you're fighting the same type of disease. And if you're eating incorrectly and you're eating the wrong diet, you can't be surprised also you got the disease. So as a dentist, with the diet I have, if I'm going to eat dessert, I can't be surprised if Mia looks at my mouth and is like, you got a cavity. That's impossible. I can't be that ignorant or that, egotistical, or just like, it's impossible. There's no way I could have a cavity. When I know what I'm consuming, it plays a big role.
Yeah,
it does
bacteria doesn't care that he has a degree.
No, it doesn't. It does not care one bit. It plays a big role.
Yeah.
Drinking the sugary drinks versus drinking water plays a big role. Mia, thank goodness she's in our life, and I say ours because my kids as well. Because if I was the one running everything, man, they'll probably get a nice little dessert every night. You understand what I'm saying? She keeps us
when he
on
packs
track.
their lunch, I'm like, junk.
Yeah.
I'm like, they'll like that. But nonetheless, man, she keeps us in track. And probably one of the reasons why my family is fairly healthy in regards to, our overall health.
Yeah.
I think it plays a big role.
It does. If there's certain foods and drinks that you're eating that lead to a disease, I know we keep talking about diabetes, but I think it's simple enough for somebody to understand. So see, the diet that you have has caused you to have diabetes. Think about what it's doing to your gum tissue and your teeth, because in order for you to consume it, it has to go into your mouth. So if you're consuming it, it is causing these problems systemically. What do you think it's doing to your teeth and your gum tissue? Changing the pH of your mouth and making you more susceptible to have cavities and
Yep, drying your mouth out. That's unfortunately one of the signs of diabetes, as well as urinating frequently throughout the night. Things of that nature. So you combating dry mouth is not making sense, and you're not one of the patients that's taking 23 pills, so you can't blame it on your medication. You could be fighting diabetes or early onset diabetes and don't even know it. And it could be because of your diet.
Yeah.
And
if these things that you're consuming are making you unhealthy in other ways, then that also has an effect on the mouth too. So for example, we were talking about earlier, people who don't have any teeth, in dentistry they're called edentulous patients. If they don't have any teeth and you're consuming all of these things that you can just swallow, like Mark said, a lot of carbs. Think mashed potatoes, mac and cheese, stuff like that. Now you're gaining weight. Now when you sleep, you might have some type of sleep airway disorder. Your airway is obstructed, which means you're not breathing well at night. Now in order for you to breathe, you have to breathe through your mouth, called mouth breathing. That dries out your mouth. That leads to more cavities. That leads to gum disease. It's all connected. So diet is so important, and people don't think about that. People don't say, "Oh, if I eat this continually, then I have a sleep breathing disorder."
Right.
They don't make the connection, and I don't think it's fair for that to say that they should automatically do that. We have to talk to our patients about this. All of us, no matter if we're a physician or a dentist, like we all have to be on the same page about getting our patients to understand what all of this means.
Yeah. I appreciate you guys coming on the show and being our first guest. I thought y'all did a great job.
Thank you.
Looking forward to being a customer at you guys' clinic. Hopefully that comes with some discounts.
Get me on camera.
Yeah,
He's covered. He's covered.
Yeah, keep doing the work that you guys do. I think that y'all's story is incredible to go from the public health sector and then move into this space now. And really looking forward to the rest of the next phase of y'all's journey.
Thank
Inspired.
you.
Yeah. Beautiful.
Thank you so much. Thanks for inviting us.
Yes,
We appreciate it.
Thanks for the luxury of your time, man.
Of course.
Thank you.